Hi, I am Dr. Nitin Prabhudesai, a practicing ophthalmologist in Pune, Kothurud area, and I have been practicing here since last 25 years. Today we will be discussing about a common eye problem which is called as red short eyes. Now what exactly is red short eyes? There are many reasons which can make your eyes red short, but one of the commonest one in our parlance is conjunctivitis. This is the outer coat of the eye which gets red and inflamed, leading to bloodshot eyes. Conjunctivitis is a common infection of the eye caused by some viruses, and it is highly contagious. So what does one do if he develops a conjunctivitis? Basically, all the red short eyes have to be examined by ophthalmologists to determine whether they are infective or whether they are due to some other causes, which we will discuss in short. From the conjunctivitis point of view, most of the time we need to keep our eyes clean by constantly cleaning them with a sterile or a clean water, and after taking a consultation from the ophthalmologist, start on some antibiotic or an antiviral medication to control the infection. However, in spite of the medications which doctor gives, it may take a few days for the red short eyes to settle down if they are because of conjunctivitis. In the meanwhile, as I said, to avoid it from spreading to your other family members or your friends, it's better that you keep cleaning the eye regularly and avoid touching the eye with your bare fingers and then touching other parts of the house with the same fingers. So it's not only important to keep your eyes clean, but it's also important to keep washing your hands on regular basis. Red short eyes other than conjunctivitis can also occur due to some of the eye inflammations, commonly known as uveitis or episcleritis or scleritis. These are inflammations of the eye which are not caused by some infection, but they are sort of an allergic reaction or in reaction of the body against its own cells. So these particular entities are difficult to diagnose unless they are examined properly by an ophthalmologist with certain instruments to determine the inner part of the eye, the amount of inflammation, and based on that the doctor can advise your treatment. One thing to remember is that as compared to conjunctivitis, where the component of pain may not be much, these other conditions I just mentioned can lead to severe pain and aversion of light. So if one has red eyes with pain and aversion of light, it is less likely to be conjunctivitis, the simple conjunctivitis, and may be a more serious problem. Also, certain types of glaucoma called as narrow angle glaucoma can present with red short eyes along with severe pain, headache, and at times even vomiting. So if one has these symptoms, it is important again to almost rush to an ophthalmologist and get oneself checked and to specifically check the intraocular pressure, the eye pressure, which can diagnose the problem of glaucoma. Trauma in any form can also lead to bloodshot eyes because the front vessels of the eye are quite fragile, and with the slightest trauma they can lead to bleeding around the eye and the eye may become red short. Fortunately, most of these front part hemorrhages, also called in our parlance as subconjunctival hemorrhages, though they look quite significant, do not cause any affection of the vision and most of the time would clear off spontaneously over the next few days. The other causes of red short eyes can be excessive rubbing of the eyes, improper sleep or less sleep, or some form of an allergy. Paradoxically, sometimes you may go for an eye examination and the doctor uses certain drops for you to see your eye properly, and those drops may per se produce allergy and your eyes can get red short, So if you develop red shot eyes following an eye examination somewhere, there is a possibility that you have allergy to those drops, and you should note the drops used for you during the examination. So these are some of the common causes of red shot eyes, and I think these tips will be helpful for you to get them solved in your day-to-day life. Thank you.